And I'm very pleased to be part of this webinar series. Amaqhawekazi, and I hope that Amaqhawe are also in the house to also contribute to this discussion, as some of us do believe that in order for us to make any changes, we need both Amaqhawe and Amaqhawekazi. And I'll be speaking about adolescent boys and young men, which is something that I'm very passionate about. It's part of the research that I think it really needs to be amplified so that it can be able to contribute in terms of all the factors that put boys and men and their partners, their family members at risk. Next slide, please. So as I start my conversation with you colleagues, I started by maybe just to give a little bit of context in terms of why we need to focus on adolescent boys and young men. And we have seen that there is a lot of HIV among adolescent boys and young men. And there are some of the things that contribute to that are related to the social, structural, interpersonal and individual level risk. So basically what it means is that there are certain things that put men and boys at risk of contracting HIV and AIDS. And it has been found that in some instances that education and employment status plays a role in terms of putting them at risk of HIV AIDS. And also there are some risks that we see in studies that young boys and men, they engage in high-risk sexual behaviors. They start engaging in sex earlier. They have multiple sexual partners, concurrent sexual partners. They practice unprotected sex. They don't use condom consistently and correctly. And then some of them, they engage in sexual activities under the influence of alcohol. And some of the issues also, they include issues of mental health disorders that boys and men undergo that put them at risk of acquiring HIV/AIDS. Next slide, please. So this slide is taken from the South African National Integrated Men's Health Strategy for 2020 to 2025. What it shows us about what are the risk factors and the priority health issues that this strategy has put in place. It shows that HIV/AIDS is also is one of the health conditions in terms of the priorities, health problematic areas that needs to be addressed. And it also shows that alcohol, substance abuse, unsafe sex are some of the risk factors that contribute to that, including exposure to violence. It speaks about STIs also as a health priority for programs such as NACOSA, as they've already said that in the introduction that they focus on HIV and STIs. So boys and men also, they are a priority in terms of STIs. And then for this age group also, we can talk about issues of mental health, as in the last part, they show that they do have. And it basically just tried to show that these are some of the health issues that needs to be addressed for boys and young men. And we know that some of the issues that are related to suicidal rates among boys and men, and issues around bullying around boys and men in schools, also outside of school. Next slide, please. So also what they have shown here, this is what basically they say that these are the services that needs to be provided for adolescent boys, which are categorized as boys belonging to the age 10 to 19. And those are the issues that, those are the services that they say that they should be provided with: HIV testing, TB screening, HPV vaccination, some behavioral interventions, and also for young men who are belonging between the age of 20 to 34. Also, some of those things are really also put as services that needs to be provided for boys and men. Next slide, please. So in this slide, I'm showing what we have done as part of the research that I was involved in, which was looking at priority setting exercise in terms of what needs to be done by the programs for boys and men. And it showed that there were some 10 priorities that were arranged by the participants in terms of the health, the sexual and reproductive health and rights. And some of those, as you can see from these slides, looking from your left to the right, those are the first 10 priorities that are shown in the first left. And those priorities, they really speaks about dealing with issues of gender norms, dealing with issues related to engaging men and boys. And then also they also show that we need to also understand that there's a diversity, there are other communities, there are other people that identify themselves, not necessarily in what we normally call as boys and men. So we also need programs that relates to that. But also we need to also make sure that we look at issues of men as caregivers. And because we need programs that also deals with fathers so that they can also be able to also understand the issues that relates to this group. Next slide, please. And then in this slide, also what we found was that there were also people that were saying that programs needs to be able to use gender transformative approaches for adolescent boys and young men. And some of those approaches has to do with engaging men and boys and make sure that the interventions, they are able to shift masculinities and advance gender equality, which is something that basically they say that it will benefit both for women and girls and also for the boys and men. And also it has to do with issues of engagement of adolescent boys and men. Next slide, please. They also other people that are also saying that we need to have meaningful participation of adolescent boys and men. And so we talk about issues of participation as way of engaging them throughout the processes of delivering our services, our programs, and make sure that when we develop them, we develop with them, when we implement them, we involve them, and when we evaluate, we are able to say what are the things that work and don't work within the programs that we developed. And also they talk about issues of if you want to advocate for policy change, it is very important and paramount that we involve them as early as possible and they have a meaningful presentation. Next slide, please. So here also some of the gaps that I found in the literature that speaks to issues of violence prevention programs for ABYM. And these are some of the issues that even our government is trying its level best to inform people and have some policies around issues of breaking the cycle of violence, and it relates to gender-based violence. But also what we found is that boys and men are also victims of gender-based violence, and there are also issues of sexual exploitation and trafficking of boys. And for those of you who are familiar with issues of initiation and circumcision in other provinces, we've seen that there is a lot of exploitation and abuse around issues of traditional circumcision, and some of the boys being taken to undergo circumcision without their consent. And some of the issues that needs to be looked into when we talk about violence prevention is how we can deal with issues of cultural sensitivity for these programs, for them to be able to have some positive results. We need to look at those issues of culture and make sure that we have resources and people that are competent enough to be able to deal with those issues of diverse communities. And also the issue of funding also, it has been proven that some of the interventions, they need to be funded so that they become long-term interventions instead of having monthly or weekly or short interventions, so that if those interventions are long-term, they will be able to be sustainable and have some meaningful contribution towards the prevention, ending of violence. And also the issues of spaces for ABYM also, it has been one of the issues that it has been found that some of the programs, they don't provide safe spaces for ABYMs. Next slide, please. So in conclusion, colleagues, I would like to say that what we found is that we need to be able to design programs that are specific and culturally sensitive to ABYMs. And also we need to train our program providers to be able to use the gender transformative approaches, which in this, in below slide, I'm trying to show you that some of the programs that we found were that they are, some of them towards issues of being gender responsive, gender sensitive, and some are gender blind. But what we mean by gender transformative is that these are some of the programs that will be able to explicitly seek to redress the issues of gender inequalities and make sure that we remove the structural barriers and empower the disadvantaged populations such as adolescent boys and young men. Also, it talks about, we say in conclusion that we need to have to engage boys and men as allies when it talks about gender equality, and also collaborate across sectors, because we find these boys and men in different areas in our societies, and it is important maybe to think about how we can contribute in terms of our programs for those that are still in schools, and but also to involve other departments where we are promoting health, or we trying to prevent, and we can use sports, we can use departments that relates to culture, so that whatever we do, is cultural sensitive. With those, colleagues, I will end my conversation with you for now and wait for questions.
Thank you very much, Dr. Anam. I'm just noting if there's any questions in the chat. I have not picked up on any questions, but we will allow an opportunity for a hand to be raised. Please indicate if you have a particular question for Dr. Anam regarding adolescent boys and young men, programmatic and policy gaps. Dr. Anam, I'm not picking up any hands, but perhaps I can take this opportunity to engage you around the conversation on gender transformation and gender diversity or gender sensitivity and gender response. What does that actually mean in relation to key populations? For instance, when we talk about men, young men that have sex with men, as well as the young transgender community, what does gender responsiveness, gender sensitivity, and gender transformation mean for those key populations?
Okay, thanks, Yolaan, for that question. Basically, what we have is a gender continuum where we start from the left and speak about issues that deal with gender discrimination. And of course, some of the programs are looking at those issues directly, and they have programs that really deal with issues that for people that have been discriminated, and in this instance, marginalized communities and the likes. Will find that they become like the center of attraction for that. But what it does, it discriminates also, because it's only looking only at those people, and those people don't live in isolation. They have families, they have friends, people that are on the other spectrum, you know. And then when it talks about issues of gender sensitivity, again, it looks about addressing issues of inequality, but without looking at what is the root cause, you know. So you would become you develop programs that are sensitive to an issue of gender-based violence because you want to deal with it. But you don't look at the deep, what are the issues that relate to that? What is the root cause of those issues? So for gender-sensitive programs, you find that they don't go as deep as possible. And also they don't engage other partners who are perpetrators. They only look at the victims because they want to deal with issues that are related to the victims. And when we respond to those issues of gender, again, you find that there are different needs for each communities, and you deal with those issues, but you only specific to those particular communities. But by gender transformation, it is an approach in this continuum where when you deal with these issues, you go deep and deal with exactly what are the issues of inequalities. You don't just blame the victims. You don't only look at the marginalized. You don't only look at the victims of gender-based violence. You go deep and ask yourself whether by dealing with those issues, are you also looking at the structural issues? Are you also looking at people that are perpetrators and engaging them? You don't want to act as if you're only blaming them as if because they are the victims, but also you want to understand what are the issues, what are the norms, what are the gender norms in the communities that speaks about women should not wear short skirts, that speaks about women should not wear gym clothes and all of those kind of things. You deal with them at that level, and then you ask them as participants to also tell you what are the issues that can be removed, what are the barriers that can be removed, that can be either cultural, be gender norms, that can make them be able to attain a better health and well-being. So that's where when we look at gender transformative approaches, we want to deal with specifically with those issues. And again, the question about issues of circumcision, there's a lot of negative masculinity that is associated with it. So what you normally do in these issues when you deal with gender transformative approach, when you speak to boys that are undergoing these rite of passages, you look at the positive masculinity. What are the things that they can do to improve their health of their families, of their communities, and not perpetuate the negative masculinity, which is all we know about it. But I don't have time to maybe deal with some of these issues. But it has to do with that kind of like approach to say we need to change the whole mindset and make sure that we revolutionize men and make them to be agents of change, to understand what is it that they do wrong for having multiple sexual partners, for having an upper hand in terms of dealing with issues of whether do we use a condom or not, issues of sexual and reproductive health issues, all of those issues. And even as
Thank you,
parents,
Doctor.
even as parents, how do we engage our boys? How do we engage our girls in a society where we deal with issues of equity as paramount, issues of justice as paramount, rather than the convenience of saying I'm raising a boy child, I'm raising a girl child, but we need to make sure that we deal with those issues.
Thank you so much, Dr. Anam. Dr. Anam, I think that we could listen to you because I think the topic of adolescent boys and young men is not always engaged with when we talk about HIV prevention, etc. So I think that, and gender-based violence, I think that there's so many more questions we could ask you in terms of post-violence care access. But there is some questions in the chat. Unfortunately, we do need to go to the next speaker, Dr. Anam. But if I could ask you, Ms. Bucas has asked, does substance use disorder have impact on young men being accepted, allowed to participate in circumcision rituals? And then there's also another question from Julian. What has the contribution been from the Department of Education and SAPS regarding the issues and keeping boys in school? So if I may ask that you go into the chat and respond to those questions as we move into the next speaker. So it's, with a lot of respect, and I do introduce Anke Houtzamer. Anke Houtzamer is a legal professional and human rights program specialist at NACOSA. She works closely with community organizations to support young people and people who use drugs. Her focus is on breaking down legal and systematic barriers and helping people access the support that they need. Her presentation is specifically on the human rights violations experienced by adolescents and young people. I do request that if you have any questions for Anke, please feel free to put it in the chat. Welcome, Anke. Over to you.
Thank you so much, Yolaan, and good afternoon, everyone. I'm just waiting for my presentation to appear. Okay, good afternoon, everyone. And I want to take a moment to acknowledge how important this conversation is. So today, as Yolaan mentioned, I'll be talking about human rights violations experienced by adolescents and young people. If we can first go to the first slide, please. Thank you. So NACOSA serves as a principal recipient for the Global Fund, managing sub-recipient organizations who are implementing the programs on the ground. So I want to take a moment to just look at what the human rights program is and how it is mainstreamed, just so that you as the viewers have an understanding of what is going to be presented today. So as I mentioned, our human rights program is mainstreamed. So specifically, it is mainstreamed through our adolescents and young people program and also the people who use drugs program. The adolescents and young people program currently serves ages 10 to 24 under the existing grant cycle, and we will see a shift to ages 15 to 24 in the upcoming cycle. And our human rights program within the adolescents and young people program is mainstreamed into servicing 4 sub-districts. For the people who use drugs program, it is mainstreamed across 8 districts. And I want to give you some insight into what the human rights model looks like. So essentially, we have human rights ambassadors stationed at the sub-recipient organizations who are the implementing partners, and they are the ones working on the ground with our young people and also with people who use drugs. So specifically what we're seeing is that human rights ambassadors are supported by their community support officers, that is within the adolescents and young people program. And then within the people who use drugs program, they are supported by their advocacy officers. They are essentially on the ground documenting human rights violations. So they are the ones speaking to the people experiencing these human rights violations. And they also then provide legal literacy sessions, community dialogues, and also sensitization sessions. So they are the ones going to our departments and assisting, for example, with South African police services and doing sensitization sessions so that they understand the work that's being done. And then also providing legal literacy sessions to our young people and our people who use drugs so that they understand what their human rights are and what the human rights violation is and what they should do in circumstances where their rights have been violated. What then happens is our human rights ambassadors will look at those cases, they will determine what needs to happen on those cases, and they will refer. So they will refer cases to our legal aids, our legal support services, to people like me at NACOSA who can then also support them in determining what needs to happen on those cases. And as I mentioned, our ambassadors are our key drivers of our human rights implementation. So if we can please move to the next slide. Thank you. So I want you to sit with this. South Africa has some of the most progressive constitutional protections for human rights globally. And we hear this all the time, let's be honest. We are always hearing that we have of the best protections. However, the lived realities and experiences of our young people and our young key populations tells a very different story. And before we go into the full presentation and dive into the data, I want you to think about this story. So please bear with me because I'm going to read a story for you. So Vuyo is 15. He's a transgender boy who loves science and always sat in the front of his class. One day, his teacher called him an abomination out loud in front of everyone. The class laughed. After that, Vuyo was no longer safe. His desk was vandalized, he was bullied, Other teachers saw what was happening. The principal was aware. The school did nothing, and nobody cared. He stopped attending. The story is not rare. Young key populations, like our transgender youth, sex workers, young people who use drugs, for example, face discrimination in schools, clinics, by community members, and in their homes. So when the people meant to protect them are the ones doing harm, we are not just failing them, we are violating their rights. And let's change that. If we can please move to the next slide. Thank you. So as I show you the stats, I want you to remember that every percentage point is someone like Vuyo. And I want you to keep Vuyo in mind as we go through this entire presentation. A young person whose rights were just violated by systems that were meant to support them. So let's look at the data. Specifically here, we're looking at adolescents and young people for April 2024 to March 2025. 2,012 cases were reported in that period. Of those 2,012 cases, 1,336 cases were referred, of which 1,307 cases were successfully referred. So I want your mind immediately to go to the question of what has happened with the 676 cases that were not referred. And just looking at this number particularly, the 2,012 cases, what about the other cases that were not reported? Assault, violence, and sexual assault make up over 50% of the reported violations. And this reflects a crisis of safety and security. And with that, we're seeing stigma and discrimination coming up as a top human rights violation, bullying, and also being denied access to healthcare services. The top 3 perpetrators are state officials, community members, and family members. So when family, community, and the state all become sources of harm, where can our young key populations turn to for protection? So again, I want you to think, are our systems truly responsive? If we can please move to the next slide. Thank you. Here we will be looking at the people who use drugs AYP cohort. What that means is within our people who use drugs program, obviously there's young people as well. And specifically here we're looking at ages 16 to 24. And this is for the period of April 2022 to March 2025. Reported cases are 914, of which 336 were referred. So again, I want you to ask yourself, what happened with those other cases? As we know, drug use and possession are still criminalized. However, criminalization does not give anyone the right to violate another person's human rights. For example, we're seeing assault, unlawful arrests, sexual assaults still being one of the highest human rights violations reported within this grouping of people. Larger numbers are obviously reported for age groups above 24, and that's what we're seeing within the data, but specifically here we're looking at the 16 to 24 age group. So what about those people within this age group who have not reported that their rights have been violated? And think about the same thing regarding the adolescents and young people specifically with the previous data that was showed. What we're seeing here is that referrals to police and medical services are strikingly low. I want to draw your attention to the top referrals in the right-hand corner of the screen. What we're seeing is that there's great internal referrals to our psychosocial support. And we would have seen the same thing from the previous slide, where there was within the adolescents and young people program, there's great referrals internally to psychosocial support. But what is that saying about our referrals to police and medical services? It's extremely low. And also what we see specifically within the people who use drugs program is that there's great fear of ongoing stigma, victimization, and discrimination. So the statistics that we see is not just data points. They are people. Violence is reinforced by silence, stigma, and poor service delivery. If we can please move to the next slide. So I want you to ask yourself this question, keeping Vuyo in mind, as I mentioned right at the beginning. Where is the accountability? As I started off this presentation, I mentioned to you that we have progressive laws. We have all these systems in place that can protect our people. However, where's the accountability? And if our government departments evaluated their own data, they would see that the policy exists, but the practice does not. So I want to hit you with some hard questions. To the Department of Health, where's the investment in youth-friendly services? Why are nurses still turning away young people seeking sexual reproductive health services? Because this is a reality. Department of Basic Education, where's the consistent rollout of comprehensive sexuality education, especially in our rural schools? How are schools being held accountable for discriminating against our LGBTQIA+ learners or pregnant teens? To SAPS, where is the training on dealing with young people from key and vulnerable populations within a human rights compliant manner? And Department of Social Development, are we really protecting our youth? And it's time for our departments to stop hiding behind the strength of the Constitution and what the law says and start matching the law with real delivery. Next slide, please. So this is obviously a lot of points that I've mentioned here, and I can't go into all of them. But we need to do better, and we need to hold systems accountable for young key populations. So these are not just recommendations, they are calls to action. So accountability, for example, holding our duty bearers accountable is important. What we need is explicit and mandatory human rights and anti-discrimination training for all our government staff. We need to institutionalize mandatory interdepartmental collaboration to support coordinated and rapid response teams for young key populations. Because what we're seeing is that our government departments work in silos. And we need to change the system so that we have rapid responses. And then importantly, we need to support legal reform to decriminalize drug use and sex work in line with public health and harm reduction approaches. And I don't want to dive too much into that within this discussion because I know Charity will also be touching on a portion of that within her discussion, but also it is one of our webinars and I want you guys to join the following webinars so that you can also engage within those topics. But essentially what we need to do is push for trauma-informed and rights-based alternatives that respond to the drivers of risk and not just outcomes. So with all of this being said, I want you to go away from story to reflection. And I urge you to consider what would you do differently tomorrow to ensure that the next Vuyo is protected and not punished. What will you do and what accountability mechanisms are you going to put in place? Thank you so much.
Thank you so much, Anke, for that presentation. And if I may be so bold, for your realness in terms of your call for action and holding, those responsible and accountable. I did notice one question in the chat regarding the data, which I've responded to, if that's okay with you, asking about the national figures in terms of the AYP, adolescents and young people data you showed, as well as the young key populations, or specifically the young people who use drugs. I've responded that the infographics on NACOSA's programmatic data based on the programs that have been implemented and managed by NACOSA through the district implementers. That's the data, and we'll be sharing the presentations. I just want to note, is there any further questions? I'm not noting any other questions in the chat. May I ask, if you have a question, you are welcome to raise your hand and technical support will then unmute you. So Anke, this is probably my favorite part of being a moderator, is that I get to ask all the questions that I want to know. So Anke, I think the one particular question I have is maybe just seeking clarity around the number of referrals for young P-word based against the number of violations. We do know that in this program that the violations such as confiscation of needles there is no real referral pathway. So you would see a discrepancy on the number of referrals based on the number of violations reported. And that needs to change, right? So if there's particular violations that are experienced, because of the criminalized, aspect of drug use or sex work, we have key populations, especially young key populations, that are not going, and seeking restitution because of this. So what is your opinion, particularly around referral pathways and agencies for young key populations?
Thanks, Yolaan. Well, the truth is that everybody is afraid. There's great fear that exists. So even if it is a confiscation of clean needles, for example, technically what we're seeing is that they could refer this case. There could be a referral, we could take steps. But the truth is that there's so much fear of retaliation and there's so much fear of the system. And that is why I touched on this within the discussion, that in reality, our young people are not going to want to report this violation. And also because of their age, they're fearing that they're going to be turned away, because there is so much stigma attached to a young person who is using substances, for example. And not just young people. I mean, if we put it into perspective, there is so much fear of retaliation and what the system is going to do to them if they do acknowledge that, look, I've got a substance use problem and this is where I'm at. And the truth is that, as I mentioned, with confiscation of needles, what we see a lot of the time is that, and I think Charity will also touch on this, is that they are entering the harm reduction programs, they get clean needles, and then there's confiscation of a clean needle. There's no reasonable suspicion, for example, that is attached to that by having a clean needle, because someone who is diabetic, for example, can also have clean needles on them. But the police is obviously stigmatizing them, sees them with clean needles, and that's when the arrest happens. And the police then base that arrest based on reasonable suspicion. And they rely on what the act says, and they rely on reasonable suspicion. And essentially, that's just the system that is in place that we're seeing.
Thanks, Anke. I think that there's maybe one particular last question from my side before we move on to the next speaker. And just to acknowledge that NACOSA has been working robustly with the National South African Police Services around sterile needles and syringes. And we found a very strong ally in the South African Police Services that we hope to move towards a national directive around the seizing of confiscation. But the last question I have is that you put out a call for government. You put Department of Social Development and Department of Health on blast. But where is the call for the public? Where is the call for communities in terms of their support for young key populations programs and policies?
That's a very good question. And that's also why I posed the very important story of Vuyo to all the listeners. And, you need to call out all your people that you see are doing things that are questionable, firstly. So all of us that are joined to this meeting, we're most likely within the NGO space and working towards a common goal. But what about your aunt, who is quite problematic and making statements against people within the community? Are you calling her out? If she makes a statement about the problem of drugs, for example, in the community, are you informing her? How do you get her involved within the conversation? And then also to make the same call to government. Because the truth is, as I said, our government departments work in silos. But the truth is that us as community members, and I say us because we all within the respective spaces, we also work in silos, and we also assume that everybody understands what we're doing and what the goal is, and we're not bringing everybody into the conversation. And I think that's the call to action for everybody else. Bring your people into the conversation, hold them accountable.
Thank you so much, Anke. We appreciate you. Just to alert everyone, in the chat, there is a short survey that should not take you longer than 3 minutes. We want your opinion as the community around what are the programmatic and policy gaps that you are seeing in your areas, whether it be in Limpopo, whether it be in Kenya, whether it be in a Latin American country. What are the policy and programmatic gaps that you're seeing in your areas for young key populations? So there is a short survey. Please follow the link in there and it will take you there. Should not take you longer than 3 minutes. Without further ado, let us move on to our next speaker. Charity Monareng is from the Students for Sensible Drug Policy International. She serves as the Executive Director for this Students for Sensible Drug Policy International, spearheading global youth-centered drug policy reform. Her work champions harm reduction, human rights, evidence-based approaches, focusing on empowering young people and advocating for policies that prioritize health and social justice. If I may be so bold, I must say that I have a bit of a crush on Charity because she's a true champion to young key populations, particularly around harm reduction policy reform. So Charity will be presenting on a policy brief, the Young People's Access to Harm Reduction Services, that was commissioned by NACOSA and has been undertaken by the Students for Sensible Drug Policy International. Charity, over to you.
Thank you so much, Yolaan. So afternoon, everyone. As Yolaan mentioned, I am the Executive Director of Students for Sensible Drug Policy International, and I think I'm really, really honored to be presenting on a topic that's really close to my heart. So I will be presenting on a policy brief that we undertook, commissioned by NACOSA, as Yolaan mentioned. Next slide. So just a bit about SSDP. So we're the largest grassroots network of students and young people advocating for sensible drug policies with chapters in various countries. We work to empower young leaders. We engage in policy and provide harm reduction strategies, but also provide technical support to respective or relevant departments. Next slide. So why does this discussion actually matter? So across Southern Africa, we are starting to see that there's 37% of adolescents are using substances. Most used substances are alcohol, tobacco, and cannabis. However, we are starting to see, or we have been seeing, an increase in the use of other substances as well. We have anecdotal stories and some research, very limited research, that talks about the age of initiation of young people as young as 9, engaging in high-risk practices. However, our current policies leave out minors from harm reduction services. So it is important to acknowledge that this is a human rights crisis and a public health imperative, because young people tend to be the most affected by HIV infections, by drug use, and yet current policies, though they claim to protect young people, they are naturally doing a disservice by prohibiting young people from accessing life-saving services. Next slide. So the purpose of the policy brief was basically to address the policy vacuum for harm reduction services, particularly around NSPs for minors. So the policy brief specifically focuses on minors, 18 and under. It's to challenge the abstinence and prevention-based paradigm with a rights-based, evidence-informed approach. And I think one of the things that we need to be honest about in South Africa is how ineffective, or to some extent ineffective actually, how our prevention strategies have been in addressing drug use. So literally any person can come today and decide to run a prevention program, because all you have to do is just say that kids should not be using drugs, and that has not been effective because we are still seeing an increase in drug use among young people, and we're not doing enough to address these issues. There's also a denialism that young people and adolescents are using drugs, and this is a very big challenge because nationally we do not have enough data to support our advocacy efforts, but we are really seeing younger people accessing treatment. We are also seeing that a lot of young people are not accessing services because the services are not suitable for them. So the purpose, again, for the policy brief was also to push for legislative reform, protective guidelines, but also to advocate for youth-centered services. So a place can have services for anyone, but if they're not friendly to young people will not be accessing those services. So the methodology that was used was basically a desk review of legal frameworks, service provider inputs, and international guidance. Next slide. So harm reduction in South Africa. So we do have harm reduction services. So as Anke presented NACOSA does implement or has implementers of harm reduction services. There is a CDC funded harm reduction service, but there's also only one government funded harm reduction service in the country. And this is in the city of Tshwane. It's called the COSA program. However, these harm reduction services do not cater for young people or adolescents. So they are mostly for adults. And during the consultation, while I was developing this policy brief, we had service providers talking about how they were explicitly prohibited to not provide harm reduction packs to anyone under 18. And so there are no legal protections for providers offering clean needles to minors, mostly because of what Anke alluded to, is that police are using clean needles as evidence to suspect people that people are in possession of drugs, but they're also using clean needles as evidence. So there is also strong stigma and criminalization persists. So drug use and possession is still criminalized, which means people are not going to be accessing services because of the fear of being arrested. And of course, the stigma. So imagine you're a young person, imagine you're a young woman. Already the fact that you are using drugs is an even bigger stigma. And so society, not only do you stigmatize yourself, but society also stigmatizes you, which means that you're going to continue being hidden and you're not going to be able to access services, and service providers are not able to reach minors, essentially. So there also is a limited integration into school and adolescent health services. Anke alluded to this, the call for Department of Health and Department of Education, as well as Department of Social Development, to ensure the integration of services or health services or life-saving services for young people in their respective services. And then law enforcement interference is quite common. This has been mentioned. And we can't stress this enough. However, it's great to hear about NACOSA's work engaging with SAPS and other organizations as well, like SANPUT, engaging with SAPS to try and see how police officers can really do their work with dignity, where they're not discriminating against people who use drugs and really treating people with dignity and respect. Next slide. So some of the key gaps that I identified as I was developing this policy brief is, again, criminalization of use and paraphernalia, even for minors. So the criminalization of drug use, as I mentioned, keeps people away from services, but also drives drug use underground. So we don't know the extent of drug use in the country. We only operate on estimates, and we do not have national data on the extent of or the prevalence of drug use among minors, which doesn't mean that there is no use or injecting use among minors. So the absence of data does not mean the absence of an action actually happening. There's also a lack of legal clarity for providers because they fear arrests. I think there's also inconsistency in the policies, where we do have policies that can support or can make provision for harm reduction services. And so we need to ensure that there is this there's synergies among the this harmonization rather of legal frameworks and policies as well as laws to ensure that there is provision for harm reduction or NSP services for minors. So as I mentioned, there are no NSPs designed for young people or any services or harm reduction services, particularly for young people. The harm reduction services are not youth friendly, and so young people will not be accessing these services. There is no disaggregated national data, as I mentioned, so the lack of data does not mean that we are not seeing injecting drug use among minors. Another issue is around parental consent, because young people or minors need consent from parents, even though there's a policy, the Children's Act, Section 129 of the Children's Act speaks about how young minors are able to access medical services at the age of 12. This doesn't necessarily apply to harm reduction services because, as I mentioned, service providers are really the ones that are told explicitly to not provide harm reduction packs to minors. There's also a stigma and misinformation. So services are seen as enabling drug use, and this has been a consistent message that we've been told as harm reduction advocates that we seem to be providing drug use, but this is also just a misinformation and also a fear of change, essentially. There's also a moral panic, which is driven by conservatives as well as religious narratives. Next slide. So global and regional precedents. So the World Health Organization and UNAIDS have published a few reports that support adolescent-friendly harm reduction services. This is mostly because they have been seeing an increase in HIV, hepatitis infections among minors. And so they explicitly support adolescent-friendly harm reduction services where young people are able to access services, or literally a one-stop shop for them to be able to access services where they can get assistance for their substance use, mental health assistance, and overall health services at one-stop shops. Section 129 is a mention of the Children's Act. Minors 12 years and older can consent to medical treatment. However, this doesn't necessarily apply for harm reduction services. And then in I think 2 years ago, we saw the South African High Court put out a judgment, particularly around cannabis, following the cannabis judgment, that children should be in care systems and not court systems. So this basically states that if a child is in possession or using cannabis, they shouldn't be arrested and should rather be referred to social services. And I think this is a precedent that can apply to all minors that are found in possession and using substances. And then you also have countries like Portugal and Norway who embed child protection within their harm reduction services, where young people, or minors rather, are able to access services. Next slide. So the case for reform, the reason why we need reform to ensure that adolescents and young people have access to harm reduction services. They need to, it's an imperative because it helps prevent HIV, hepatitis, as well as overdose. It ensures that their rights to health, dignity, and life are respected. It is cost-saving exercise. We've seen examples in Portugal where investments in harm reduction services has saved money for the government as well as taxpayers. And then, of course, the moral argument is that compassion over punishment is the preferred method. Next slide. So what governments, CSOs, youth, and partners need to do. So governments, policy harmonization to decriminalizing drug use, decriminalizing paraphernalia for minors, amending the Children's Act to explicitly include harm reduction, providing budget for youth-friendly focused harm reduction services. Civil society organizations need to create youth-friendly access points. They need to train providers in child-specific harm reduction and push for public education to reduce stigma. Young people, we need to ensure that young people and minors are involved in co-creating spaces for themselves, and also for them to share experiences to inform programming, and then for development partners to fund services for minors, and also support M&E frameworks to collect age disaggregated data. Next slide. So key policy asks from the policy brief: legal reform to decriminalize drug use, possession, as well as NSP access for minors, protective guidelines for providers, age-appropriate NSP and harm reduction models that are peer-led, that are mobile and non-judgmental, funding for pilot projects and integrating into the adolescents and youth health policies, as well as the National Drug Master Plan, but also to monitor and evaluate with youth voices at the center. Next slide. So to protect children, we must first see them, and to see them, we must stop criminalizing them, particularly for those who use drugs. And I think that's the last slide. But yes, if you want to stay connected, you can find us on our social media, our website, and our email. And that's the end of my presentation. Thank you so much.
Thanks so much, Charity. I'm just looking in the chat to see if there's any particular questions. I see Julie says a fantastic presentation. May I just check if there's any questions? You are welcome to raise your hand. I don't see any questions, Charity, but of course, I will always have a question or two. So, Charity, I think that we working in the space that we do, we recognize intersectionality, that when people think that decriminalization or access to harm reduction services for young people who use drugs, that they think we're just talking about, people who use drugs, but we recognize that within young key populations, we do have, young people who use drugs that are also involved in sex work, that also identify and are transgender, that are also, young boys or young men that are having sex with men that are also using substances or using drugs. And so I think that your points are that, this is a much bigger conversation than just policy brief around drug use for key populations. So what are your thoughts around that particularly? Charity, it seems we have you on mute.
Yes.
Over to you.
Okay, so I think I hate referring to like adult movements and young and youth movements, but I'll use that in this term. So we see this happening in the adult space, and youth spaces or youth movements, even though we try to be a lot more progressive, but we are hindered by what adults do in the adult movements. And we already see these silos and these silos really within the different movements, where you have young people, or where you have people who use drugs separated from the sex work movement, separated from the LGBTI community movements. And even though all these movements cross-cut, we all compete for different things, or we're competing for the same space. And so priorities are not necessarily, we get our priorities all wrong. And we see this translated among young people, where the intersections are not really acknowledged. We don't see the intersections happening. And it's like you said, it's beyond just young people who use drugs. It's young people who are involved in sex work. There's the intersection of climate justice and sexual reproductive health. So all of these different issues, everyone is trying to, I guess, make enough noise or find their space, and there isn't enough. I mean, even though we're starting to see like a shrinkage in the civic space, but we just all competing against each other, that it makes it quite difficult for us to acknowledge all these intersectionalities. That I think if we all acknowledge that we all can contribute to each other's movements, we could eventually achieve all the goals that we want to achieve. But I think, I hate to say this, but funders also pit us against each other. And that's why we also start to see like a lack of intersectionality in the different movements. So it's really around competing for space, the influence that we see among the adult movements, and how programs really need to start looking at intentionally acknowledging the intersections of young people, because services can not only cater, like, for example, if we create a youth space, it can't only cater for young people who use drugs. You need to be able to cater for young women, the young people who use drugs who are sex workers, or young people who are sex workers, and so forth. So really ensuring that programs are also intentional in acknowledging the intersections of young people, and not just, I guess, regurgitating and repeating the errors of what we've been doing for the longest time.
Thanks, Charity. And to recognize that harm reduction is not just sterile needles and syringes, to recognize that it is comprehensive, holistic services of treatment and psychosocial support and economic empowerment. So thank you so much. Charity, I do note Julian's question or comment around decrim for personal drug use. And Julian, thank you for your support. You are definitely invited to the next webinar, which is going to be talking about decriminalization. But I do note that Julian's made a comment about SAPS and the courts managing adolescents selling drugs. I think this could be a very big conversation, Charity, Perhaps you can make some comments in the chat, but if you don't mind, let's keep it in mind for the next webinar on decriminalization. What does that mean for the judicial system? So thank you so much, Julian, for that great comment. We'll move on now to our next speaker. But just to also remind everyone, because I'm paying very close attention to the survey, we would like and appreciate your input in terms of programmatic gaps and policy gaps for young key population. So please complete the survey. It should not take you longer than 3 minutes. We now have the lovely Mmbatho Majuda from SANAC and Gauteng Office of the Premier. Mmbatho is a public health leader and youth development specialist with 9 years of NGO experience, currently serving as the Gauteng Provincial Technical Officer for the Adolescent and Young People Program. Her expertise lies in psychosocial support, community system strengthening, and HIV prevention, treatment, and care. She coordinates stakeholders to implement key strategic plans, demonstrating her passion for youth-centered development and making her a powerful advocate in public health. Her presentation specifically will be on the role of civil society and government in addressing gaps in young key population programming. Thank you so much, Mmbatho. Over to you.
Thank you so much. Good day, colleagues, stakeholders, leaders, comrades. I appreciate the platform that I've been given this morning. Afternoon already. I'm just going to go straight into my slides, but before I start, I just want to acknowledge the South African National AIDS Council. I don't have a slide explaining exactly what we do, but our responsibility is to bring together government, civil society, and the private sector to create a collective response to HIV, TB, and STIs in South Africa. So we have the same or similar structure at a provincial level for all the provinces, and this structure is then led by the premier of each province. So I am based in Gauteng. And yeah, just to acknowledge you for the opportunity to engage on a topic that is very critical to our collective response, especially when we look at the role of civil society and government in addressing the gaps in programming for adolescent and young key population. So in my presentation, apologies, just go back to the first slide. Yes. So what is critical from my presentation, second slide, please, apologies, is to examine the current programmatic gaps in South Africa's response to HIV, TB, and STIs for young key populations specifically. And then secondly, we will look at exploring how the government and civil society can work together, not in silos, but as co-creators of solutions. Before I start, I just want to leave you with a thought or a question, asking how do we expect young people to trust systems that were never designed with them in mind? That's the tension we're here to confront, and hopefully we begin to solve this. Next slide, please. So who are we talking about when we are talking young key populations? Those that are familiar with the NSP for 2023 to 2028 will know that there is a group of people that have been defined as key populations. And those people include our trans and gender diverse people. We have gay men who have sex with other men. We have people in prison. We have sex workers and their clients. And we want to now ensure that this is adjusted to the young key populations age groups. So here we're looking at 15 to 24-year-olds that are adolescents and young adults who, due to a high risk of behaviors and social positioning, they face heightened vulnerability to HIV and often fall through the cracks of traditional programming. Now, why is this the case? When we look at epidemiology, we see that there is still stigma and discrimination that are severely impeding our progress towards the 95 targets. And if you are in this meeting, this should concern you because we are all working towards that same goal. When we look at structural challenges, we see that young key populations exist within systems that were not built to support them. I think the speakers before me spoke quite broadly about this challenge that leads to exclusion, due to gender norms, poverty, and even criminalization issues. But what is also critical is collaboration. The speakers before me spoke quite succinctly also about the fact that not one sector is needed here. If we all continue to work in silos, we will continue to not see results. And finally, sustainability. Sustainability is going to be very key in ensuring that we mitigate service disruptions that harm the continuity of care and access. We're all aware of the executive order and what that change has led to in our programming. So our programming needs to guard against such disruptions. Next slide, please. So what is currently happening on the ground? The burden of HIV, TB, and STIs among young people, especially our young key populations, it's well documented. But what remains underaddressed is the intersectionality of their experiences. I think this has been touched on, but it really is becoming important for us to ensure that we look at making adolescents belong to more than just one key population or one, sector, but acknowledging the fact that there are sometimes intersections in their lives. Transgender and youth and young men who have sex with men are subject to criminalization, stigma, as well as violence. Young women are involved in commercial sex. They also then experience sexual abuse by police. They experience police violence. And of course, the societal rejection that is attached to the community members, but also their own families that seem to, not understand their lives. However, what we also see is funders who have prioritized funding programs such as the Human Rights Program that was discussed earlier by the Global Fund and NACOSA. We also know that there are P-Wood programs on the ground as well as sex worker programs. And yet we must acknowledge that there is still gross underfunding for KP interventions, which leads to a fragmentation of services. So a young person will show up to a particular site and they will only be treated for whatever that organization can provide. And because we also lack an active referral system, we lose so many of them in the cracks. In other institutions where services exist, they are often not safe, they are not youth-friendly, and they are not rights-based. We know that the Department of Health, for example, has youth-friendly services, but how accommodating are these services to the young key population? Next slide, please. All right. Now, as I mentioned earlier, civil society, specifically the Civil Society Forum, is one of the key partners to the three-legged part of the AIDS Council. So we are constantly working with them to ensure that they are playing a role in bridging the gap between community and institutions. What are their roles in this particular program? It's to act as the voice of the youth, families, and communities. So we all know that the sectors of civil society cover a wide range of leaders in the community. And those are the people that we really need to speak up, because the leaders are able to influence much larger groups than if we were to target individuals. We want to ensure that civil society is also mobilizing inclusive, rights-based responses to go where formal systems cannot go. We want them to participate in mapping hotspots, co-designing services, and driving community-led monitoring to hold systems accountable. I think we're constantly talking about the role that government should be playing and the gaps that exist in the system. How are we using CLM in the key population program to make sure that governments are actually held to account? And lastly, but importantly, civil society can connect the dots between young key populations and public service. And they can build safe spaces for young people in order for them to not only survive, but thrive. Next slide, please. Okay, now let's look at the role of government. Equally, the government must play a very important role. I think, colleagues, I cannot repeat what you have said. It was quite loud and clear what we need from the government to participate in this response. But I think also important is to ensure that there is alignment in our policies. So we have this beautiful constitution. We all have these policies that have been designed by individual departments. But how do we make sure that these policies actually speak to each other? And even more importantly, tie back into the NSP, which has already given us guidance on how we are to implement the HIV, TB, and STI response. We want the government to focus on funding and supporting youth-led initiatives. Let's stop just talking about inclusion, but let us ensure that we resource inclusion. The government has developed key population centers of excellence around the public health facilities, and this is fantastic. However, we still don't have age-desegregated data systems that can capture the data of key populations that are visiting our facilities and all other government institutions. So we need to build this capacity. We need to also ensure that our systems meet the needs of our people. We need to also ensure that government is prioritizing justice and legal reform to decriminalize survival behaviors. I think this I won't touch on. I think the colleagues before me did such a good job in ensuring that it is highlighted. Strengthening cross-sector responses. This is where we come in as the AIDS Council to ensure that government departments are working together. But not only are they working together as governments, but they also have discussions with civil society as well as the private sector so that we can have a comprehensive response to these challenges faced by young people. At this point, I'll also highlight that SANAC has already started working with the Department of Basic Education, DSD, and NDOH to start leveraging on existing policies and come up with the documents that we can all work together on. And I will touch on this document later. Next slide, please. All right. So these are the key framework principles that have been highlighted in the plan that is now currently in development. But basically, colleagues, what it highlights or what it prioritizes is a people-centered approach. We want to ensure that we're not planning services around diseases, but around the needs and expectations of the people that we serve. This means that we must elevate the lived experiences in our planning. So when we plan as government departments, as institutions, we cannot plan alone, but we need to make sure that we are speaking directly with the young key populations who are affected by the realities on the ground. We need to ensure that we ground our work in equity, human rights, and intersectionality. So have a holistic approach to how we're going to respond to the needs of young people. And lastly, we want to create solutions that are responsive, scalable, and again, sustainable. Next slide, please. So this is just a summary of our challenges and opportunities. For our challenges, obviously we could list and list forever, but I think, just the fact that we have policies that don't speak to each other and don't speak to the lived realities on the ground is a challenge enough on its own. There's so much work just for us to do on that front alone. But also poor service readiness, the stigma that is experienced by young people in our facilities, in our institutions. And we must also face the chronic underfunding for these programs. However, we need to also acknowledge that there are opportunities, low-hanging fruits, things that we can start working on based on what we already have. And this is the peer-led models. We have seen this work quite well in the AYP program. So it is easy for us to integrate and adopt the strategy. We're also seeing quite a number of organizations start to prioritize digital outreach, which is good because it means that we will reach even more young people. And the growing commitment to multi-sectoral collaboration. I can sit on this one for a while, colleagues, because of how important it is. At this level, we are still working to ensure that we bring in even more government departments to the party. As critical as national or the Department of Health, the Department of Education, and the Department of Social Development are, we need to also recognize that there are a lot more departments who can be assisting us to ensure that our services are comprehensive and can develop the young person holistically, not just from a health or social perspective. And lastly, the call for research and youth-led monitoring is getting very, very loud. Let's ensure that we are including youth leaders so that they can guide us as we are implementing on the ground when we do our consultations, not just at the inception stage, but also as we implement the programs. Let's bring them back to ensure that we are still aligned, we are still relevant to the culture, and we are still relevant to the communities that we are trying to improve. Okay, so my next slide, please, which should be my last. Colleagues, as I wrap up, a call for action and some strategic recommendations. I think what stands out is the importance to ensure that youth-led organizations are at the center of our implementation. What this will do is create genuine pathways for co-leadership, but it will also ensure that we are, utilizing the most relevant person to this implementation, which is the young person who is also a key pop and who is affected by the realities on the ground. We want to strengthen the age disaggregated KP data. So we know that our systems, whether in facilities, whether the Departments of Social Development, Education, they do not cater for KP data. So we need to start moving towards ensuring that when we say we are providing services, we can also provide the data that speaks to that. We want to also ensure that we scale the harm reduction services and safe spaces for young key pops across the sectors. This should include education, justice, as well as corrections. We want to prioritize intersectional, rights-based approaches that address multiple layers of exclusion at once. And lastly, let us build sustained platforms for multi-sectoral collaborations, not just campaigns. Campaigns are great. They bring awareness to the work that we're doing, but let's ensure that it also translates into the work that we are doing with each other on a day-to-day basis, and not just when we have to come together for campaign purposes. Next slide, please. Thank you so much, colleagues. Just some of the references that I've used, but just to highlight that the national guidelines are still in development, and funding is needed for that to be rolled out, and we're hoping and trusting that that will be done very soon. Thank you so much, NACOSA, for the opportunity, and thank you, colleagues, for being my audience.
Thank you so much. I think that we were quite impressed, and I suppose a little bit, feeling more hopeful, seeing the strides that have been made by the SANAC as well as by other institutions in terms of the drive towards young key populations. But I do need to ask a question. I do see that you've mentioned some disconnect between policies and the actual implementation of those policies, and then what you are seeing or hearing from lived experience, especially with community-led monitoring data that has been provided. Why do you think there is such a disconnect between policies and actual implementation and realization of those?
Apologies, sorry. Almost lost my screen. Thank you so much for that question. I think through the consultations that SANAC has had, it's becoming quite clear that although sometimes we do put down policies and we get them to be approved, they are not always accompanied by budgets. And some of them, a lot of them, are created in isolation, which is why we need to also look at the method in which we're developing our policies. Did we sit alone as a department and decide that this is how we're going to do things? Or did we actually consult not only our partners in government, but civil society and the actual population that we're trying to target? So that is why the model of consultations is so fantastic, and it should be replicated. It should also be institutionalized. You cannot develop a policy from start to completion without ever consulting the people that it will serve, the communities that it will serve. I think some of you colleagues would be aware of the CSE model that is implemented in schools. That model received so much backlash because of the lack of consultation that was done for that program. So as we start with this, we're very cognizant of that. We're ensuring that we continue to do consultations. It's not just going to be at the beginning, but it's going to be also as we progress. And I think it's important for stakeholders to take these consultations seriously. You know, do not send someone that cannot speak for the department and cannot give the accurate picture of how the program runs. And, you know, because also all of our policies cannot speak to each other. But if we sit in one room and actually figure out, okay, why does this need to be done in a specific way, then we can see how we fit it all together by having continuous discussions. So yeah, I think that's where we need to improve. Thank you.
Thank you very, very much, Mmbatho. And once again, thank you again to SANAC for your continuous drive to raise awareness and policy reform and development in South Africa. I think we'll now start concluding. So just some closing reflections, if you will allow me. From our various speakers, we are very clear now that the young key populations are, affected by the rights violations, and it does lead to poor health outcomes and disengagement from services, as it was mentioned by Dr. Anam, as well as by Anke. We do realize that there's, layered vulnerabilities. I think Charity particularly spoke around criminalization, as well as the intersectionality that is not addressed in terms of, our programming. I recognize that we also have an issue around service delivery, where we have implementers, as Mmbatho's mentioned, that can only provide certain services that has been funded. But the reality is that young key populations do require, youth-friendly services. And we do see a disconnect, and where we see silos operating not only between government and civil society and the youth organizations, but also within civil society and within government. There's still silos operating as opposed to collaboration. And we do also recognize, and particularly Mmbatho and I think Charity mentioned, is that we are the co-creators of the solutions. We have young people, programs for young people, policies for young people, but how much influence have they had to that development? And then lastly, Charity and Anke spoke specifically, as well as Dr. Anam spoke specifically about looking at policy reform, looking at the age of consent, decriminalization, and particularly strengthen the funding response domestically and internationally for young key population programs. So thank you once again to all my speakers, Dr. Anam, Charity, Anke, as well as Mmbatho, for your key points. And we will be sharing your presentations with those that have been in attendance. I also want to thank all my attendees for coming. We actually had 83 attendees for our first webinar, and we look forward to hosting you in future webinars. The next webinar is on the 22nd of July. That would be Tuesday, the 22nd of July at 12 o'clock, where we will be talking about decriminalization of sex work and drug use for personal use. So we ask you to register for that webinar. And once again, we'll make sure that our speakers have an opportunity to engage around your questions. So without further ado, I would like to extend my gratitude and appreciation once again to our speakers, but also I want to extend the appreciation to you, the attendees, for being on board and, being open to the conversations and driving this within your own communities. A special thank you as well to our interpreters, our French, Spanish, and Sign Language interpreters, to our technical support team from SANAC Active. And then lastly, a warm appreciation and thank you to Viv Healthcare for sponsoring these webinars, these series of webinars, but also to the Global Fund in terms of supporting this drive in human rights and advocacy for key populations. Thank you all and have a lovely day further. Keep well.